You know, the U.S. has also reached a reported 10 million confirmed COVID cases with more than 237,000 deaths.
And while the biggest surges are being seen in the Midwest, there are concerning upticks in our area. Here with a look at what is happening in the Garden State is Judith Persichilli, the Commissioner of the New Jersey Department of Health. Commissioner, thank you for joining us.
Good morning. Thank you for having me.
Of course.
Well, unfortunately, we've been talking about this uptick, this constant uptick, surge of cases in New Jersey, which is the highest in the state since, its peaks back in March and April. What are you attributing to this? What's causing this?
Well, I wish I could tell you that we have a direct cause. And, you know, this is a deadly virus. It slowed down a little bit in the warmer weather. And as we loosened up some of our restrictions and more people gathered and developed some pandemic fatigue, the only tools we have in our toolkit perhaps were left home when they went out. And that's masking, social distancing, washing your hands frequently, staying home if you're sick. These are such basic things. And I think we got a little too relaxed in the face of a virulent virus. So, you know, we're pulling back a bit because in New Jersey, over the last 3 weeks, we've had more than 1,000 cases per day. Over the weekend, some of our highest case counts than we've had since April and May, when things were really surging. Overall, we've had almost 15,000 deaths in New Jersey as a result of COVID.
So, Commissioner, you mentioned the high numbers just this weekend alone. Are you seeing specific numbers in specific areas of the state? Like we see there was a high infection rate in the city of Newark. Hoboken had some areas of concern as well. Anything you can tell us about that, about specific areas?
Well, we're actually seeing, we actually have hotspot teams, by the way, that do that analysis. And back in September, we saw a huge uptick in Lakewood, New Jersey. And we redeployed contact tracers, testing assistance, and encouraged isolation and quarantine if you tested positive. We actually brought the rate down. And just as that was coming under control, the Northeast took off. Bergen, Passaic, Essex, Hudson, all started seeing increasing cases. So our hotspot teams are working with those counties. We've been able to look at specific cities, Newark being one. Mayor Baraka, very aggressive and knowledgeable about what they have to do up there. So we keep seeing the Northeast. But as we learned in March and April, it marches down our state. The Northeast increases. Pretty soon we'll see it centrally and then southern. The overall positivity rate in the state is 7.5%, the highest it's been in a while.
Yeah.
Commissioner, can you tackle these hot spots, say, similar to how New York is doing it? You really zero in that area. I know you have contact tracers in there, but they've added restrictions in those particular areas. They've upped the restrictions. Is that something that's on the table?
The biggest issues that we have when we go into the areas is to make sure that everyone has access to testing, contact tracing, and having the contact individuals that are called by the contact tracers give information. What we're finding is that actually 60% of the people that we call refuse to say who they've been in contact with.
Wow.
That's tough. So let me ask you this, though, because some people are looking at this saying, well, why don't they just shut everything down like they did once before, right? And other people are saying, well, we don't want everything to be shut down because that hurt the economy so badly. If you're saying it's marching down the state, right, and you see what's happening in the Northeast, is there a way to then deploy resources to Central and Southern Jersey ahead of time
head it off,
to kind of hit it off at the knees?
Yeah, absolutely. In fact, in all of New Jersey, but specifically in Central and Southern New Jersey, we have teams of individuals that are in some of our larger cities, increasing testing. We've had funds given to all of our counties to set up testing sites so anyone who wants to be tested can be tested. We have an individual that is just scouring the state to make sure that every county has isolation and quarantine spaces for individuals who cannot quarantine or isolate at home. We've embedded social service workers in each of our counties to be able to support individuals who may be exposed and have to quarantine for 14 days so that they know the services that are available to them and their families, because that's a deterrent for people that have to quarantine for 14 days. They'd rather, not tell anybody. So we have social service workers in every county.
Commissioner, what about rapid testing?
On supporting individuals.
Because the state has seen, over 1,500 hospitalizations. What about rapid testing? I know you say testing facilities are available, you're providing testing, but would that really increase this, especially if people aren't saying where they got it from? They're not giving you the information you need for the contact tracers.
Well, let's first look at hospitalizations. We announced 1,500 hospitalizations yesterday. Just as a comparison, if we go back to around September 12th, on a 7-day average, rolling average, we had 420 hospitalizations. So from September 12th to yesterday, hospitalizations have increased to 1,500. That's quite a concern. The same holds true for those individuals that are in our intensive care units. We can't encourage people enough not only to take the call from the contact tracers, but to give the information. We cannot save lives if we don't know whose lives we need to save.
Right, exactly.
And anybody that's exposed, particularly the elderly, the vulnerable, individuals with underlying conditions, diabetes mellitus, cardiovascular disease, they are at risk for death from this virus.
Commissioner, I
do
want to...
Our goal is to hopefully get that message across that you are not compromising your friends and your neighbors and your family. You're saving their lives.
Absolutely. Commissioner, I do want to ask you real quick about schools, if they're an area of concern. We see that they're rolling back some restrictions on sports within schools as well. Is there any plan on possibly maybe going fully remote once again because the numbers are just going in the wrong direction?
We work with the school districts. That's really their decision based on what they're seeing in their individual districts. Our epidemiologists have separated the state into 6 sections: Northeast, Northwest, Central East, Central West, Southeast, Southwest. And every day they post an infographic on our state that identifies whether you're in a red zone, a yellow zone, or a green zone. Obviously, 2 months ago, we were all green. Now we're all yellow. That's used as a guide to help the districts determine whether they want to go all remote. We also have a dashboard that anyone can access that will show exactly how many outbreaks we have had in our schools. I'm pleased to say that over 3,000 buildings, we have over 3,000 buildings, our actual outbreaks are quite low.
Oh, that's good news.
Under 100. They include more individuals, like more than 2 individuals in an outbreak, but quite low. So K through 12 is doing a really good job right now.
All right, Commissioner, we are simply out of time. We could talk to you much longer if we had it, but please come back on the show again. We've enjoyed having you today. It's good information.
Thank you so much.